Okay, welcome back to DK Medicines. Today I have come with new topics that is nothing but sepsis under the infectious disease. The sepsis is one of the essentials and very interesting topics under the infectious disease. In this video series, we are going to talk over in detail about the sepsis. So watch the video till the end. We are going to discuss what is the sepsis and pathophysiology and what are the septic shocks and severe sepsis, what are the risk factors for the sepsis and their presentations, and what are the investigations for sepsis and their management, and last one is neutropenic sepsis. Okay, here come to the sepsis. Sepsis is one of the conditions. In that condition, the body launches a large immune responses to an infection that causes the systemic inflammations and that affect the functioning of the body organs. Okay, next come to the pathophysiology. Whenever the bacteria and pathogens, okay, and various type of the microbes attack on the our body, okay, this type of the antigen is going to be recognized by the macrophage, lymphocytes and mast cells. Okay, this antigen presenting cells. Okay, antigen presenting cells, these cells release vast amount of the cytokines like interleukin first and TNF alpha, tumor necrotic factors. Okay, these cells, nothing but cytokines, activate other types of immune system. These immune activations lead to the further release of the chemicals such as nitrous oxides, nothing but NO. Okay, this type of nitrous oxides already present in our blood vessels in the normal physiological conditions, which is lead to the vasodilations of the blood vessels. Okay, here this full immune response causes the inflammations throughout the body. Okay, due to the release of the various cytokines, they are going to cause the endothelial lining of the blood vessels. Okay, due to the permeability of the blood vessels, whatever the fluid is present inside of the blood vessels, that is going to leak out of the bloods, okay, into the extracellular spaces. Okay, leading to the edema or reductions of the intercellular volumes. Okay, next come to the coagulation systems. Okay, after the species of the coagulation system, various type of the cells like platelets, RBC cells and fibrin proteins, they are going to deposit it into the blood. Okay, consequently lead to the compromise to organs or tissues, and the consumptions of platelet and clotting factors lead to the thrombocytopenia and hemorrhage. In these conditions, bodies or bloods are unable to form clots or stop the bleedings. This condition is known as DIC, nothing but disseminated intravascular coagulopathy. Okay, due to the organ hypoperfusions, okay, blood lactate level is going to increases. Okay, and this condition is going to switch into the anaerobic respirations. Okay, as we know, the lactate is one of the waste product of the anaerobic respirations. Okay, anaerobic respirations. Come to the septic shocks. Whenever the arterial blood pressures drops, the result in organ hypoperfusions, and this hypoperfusion is going to lead to a rise in blood lactate as organ begins anaerobic respirations. Okay, and this condition is going to measured by the systolic blood pressures whenever the systolic blood pressure is less than 90 mmHg. Okay, and whenever the lactate level is increases greater than 4 millimole per liter, we can say that condition is hyperlactemia. Okay, and come to the treatments. The septic shock treatment, the first treatment is IV fluids and next one is inotropes, nothing but noradrenaline. Okay, which is used to increase the force of contractions of the hearts. Okay, next come to the severe sepsis. The severe sepsis is nothing but is defined as when the sepsis is present, okay, and result in organ dysfunctions. Okay, for examples, hypoxia is the condition whenever the absence of the oxygen in our tissues. Okay, oliguria is a condition whenever the urine output is less than 400 ml per day. Okay, per day. Next, AKI, acute kidney injury, thrombocytopenia and coagulation dysfunctions, hypotensions, and hyperlactemia. Okay, in this condition, the lactate level is increases more than 2 millimole per liters. Okay, next come to the risk factors. First risk factor is old patients and young patients. Okay, as you can see, this is old patients and this one is young patients. Okay, are more prone to have a sepsis. Okay, and chronic conditions like COPD and diabetes. Okay, pregnancy is also one of the risk factor for the sepsis, and in devices is also responsible for the sepsis. Okay, to cause the sepsis like catheters and central lines. Okay, due to the surgery, the recent trauma and burns. As you can see, this is a trauma patients. Okay, and this is a burn patients, and this is surgery patients. Okay, these things also causing the sepsis. Okay, these are the also risk factor for the sepsis. And come to the chemotherapy and immunosuppressants are also one of the risk factor for the sepsis. Okay, like use of the steroids. Okay, and come to the presentations according to the news. Okay, nothing but national early warning scores. Okay, national early warning scores, which is mainly used in UK to pick up the signs of the sepsis, physical behaviors and consciousness level of patients. Okay, here we can rule out of the temperatures and heart rate and respiratory rates and oxygen saturations of the patients, blood pressures of the patients and consciousness level of the patients. Okay, next, other signs of examinations like cellulitis, discharge from the wounds, cough, dysuria. Okay, urine while difficulty while urinations. Okay, non blanching rust indicate the meningococcal septicemia. Okay, and come to the reduced urine outputs. Okay, and motile skin, nothing but livido reticularis. Okay, livido reticularis cyanosis, where the in this condition the skin color is going to appear like blue. Okay, new onset atrial fibrillations. Okay, here you have to remember that tachypnea is the one of the first signs of the sepsis. Okay, here the neutropenic and immunosuppressants patients may have normal observations. Okay, you have to remember this, the neutropenics and immunosuppressants may have normal observations and temperatures despite of life threatening conditions. Okay, come to the investigations. First is full blood counts. Okay, which is used to rule out of the blood WBCs and RBCs and platelet counts. And come to the CUE, nothing but complete urine examinations for rule out of the urine infections. Okay, and kidney infections, and LFT for the liver infections. Okay, CRP, nothing but C reactive proteins to rule out of the inflammations or infections. Okay, inflammations or infections. Okay, next, clottings to rule out of the DIC. Okay, DIC, disseminated intravascular coagulopathy. Okay, next one is a blood cultures for the bacteremia to rule out of the bacteremia. Last one is a blood gases to rule out of the pH of the bloods and like glucose levels and lactate levels. Okay, and lactate levels. Next, the additional investigations can helpful in locating the source of infections like urine districts test and urine culture test. And next one, CRX, chest X-ray, CT scan to rule out of the intra-abdominal infections or the abscesses. And come to the lumbar punctures used to rule out of the meningitis and encephalopathy. Okay, encephalopathy. Come to the managements. Okay, according to the NICE recommends the risk stratifying patients into the low risk patients, moderate risk patients, high risk patients. Okay, here the moderate risk patients may be managed in the community or in a community where the diagnosis is clear. Okay, and high risk patients may need urgent attentions or management. Okay, here the patient should be assessed and patient should be assessed and treatment initiated within first hours presenting with suspected sepsis. Okay, here the sepsis 6 is nothing but 3 tests and 3 treatments. Okay, the 3 test is nothing but to rule out of the or checking of the blood lactate levels and blood cultures and urine outputs. Okay, and 3 treatment is nothing but to maintain the oxygen saturation from 94% to 98% and 88% to 92% in the case of the COPDs. Okay, the use of the empirical broad spectrum antibiotics like tazocins. Okay, piperacillin with tazobactams. Okay, and IV fluids. Okay, come to the neutropenic sepsis. This is our one of last but not the least. Okay, here the neutropenic sepsis is very important medical emergencies. Sepsis in patients with low neutrophil count of less than 1 is to 10 to the power 9 per liters. Low neutrophil counts are usually consequences of use of the anti-cancers or immunosuppressant agents. Okay, for examples, anti-cancers or chemotherapies, hydroxychloroquine, which is mainly used in the treatment of rheumatoid arthritis, and clozapines. This agent is used in the treatment of the schizophrenia, and methotrexate, which is used in the treatment of the also rheumatoid arthritis. Sulfasalazine, also used in the treatment of the rheumatoid arthritis. Carbimazoles, used to treatment of the hyperthyroidism, and quinine, used to treat the malaria, and infliximabs and rituximabs. These are the monoclonal antibodies used as the immunosuppressant agents. Okay, each hospitals will have a neutropenic sepsis policies. The treatment is with immediate broad spectrum antibiotics such as tazocin, piperacillin with tazobactam. Okay, thank you.
Subscribe now and press the bell icon. Never miss an update.